Go. Following on from yesterday's video around the upper limb, I'm today going to discuss how we can minimise the risk of common squash-related injuries in the more proximal lower limb, that being the hip and the knee. I'm going to start off with a condition that I suffer with myself, known as femoral acetabular impingement syndrome, or FAI. FAI is a condition whereby small bony extensions, known as a cam, as shown here on the femur, and pincer, which is an extension of the acetabulum or the socket of the hip joint, can result in impingement of the soft tissue structures which surround the joint, including its own joint capsule. FAI is typified by a C-sign distribution of pain, as demonstrated below. Unfortunately, impingement is often the result of a juvenile condition that can affect the development of the joint, and other causes of the condition are not greatly understood. The problem with FAI, however, is that it can lead to the rapid onset of a secondary osteoarthritis within the hip, because if left untreated, it can inhibit the glute muscles, which protect the integrity of the joint. The exercises that I'm going to demonstrate at the end of this video are designed not only to manage the symptoms of impingement, but also slow the development of any arthritis within the hip. An injury that can often go hand in hand with femoral acetabular impingement syndrome is a strain or a tear of the adductor muscles which sit on the inside of the leg. The adductors are responsible not only for drawing the leg inwards towards the body, but also for counteracting the efforts of the glutes which sit on the outside of the leg. The adductors are also involved in controlling the eccentric or down phase of a lunge. Therefore, training the glutes is a sensible way of minimising the risk of any adductor injuries. Research also shows that we're at an 80% greater risk of injuring an adductor muscle if it is weaker compared to its opposite side. And therefore the exercises at the end of this video for strengthening both the glutes and the adductors will be equally helpful in minimising risk. Moving down into the knee, and in particular paying attention to the menisci. The menisci are effectively the shock absorbers for the knee, and as we age, the makeup of each meniscus becomes less viscous. As it starts to degenerate, we are therefore more prone to tearing a meniscus if we are uncontrolled in our deep lunges or when changing direction on court. Injuries to the medial meniscus, which sits on the inside of the knee, are often associated with tears to the MCL or medial collateral ligament and ACL or the anterior cruciate ligament with which it has connections. Exercises therefore that demand single leg control, such as a lunge, a jump, or the floor-based gluteal exercises that we practiced a couple of weeks ago, are ideal for minimising risk. It is important to remember when performing a lunge or a single leg drop or any single leg control exercise to not let the knee fall inwards, because over time this can deform the MCL ligament, the one that sits on the inside of the knee, and hinder its protective qualities for the structures that sit deeper within the joint. The final condition that I want to discuss today is an infrapatellar tendinopathy. This is an injury to the tendon which attaches the quadricep muscles and the kneecap to the shin bone. This injury typically occurs again through overuse in an uncontrolled fashion. And in simple terms, the tissues which are normally nicely aligned become deranged and therefore painful to load through. Some of the exercises that I'm going to demonstrate in a minute are designed to specifically load through those tissues so that they're able to cope with the demands placed on them when playing squash. The common theme it is important to remember across all of these conditions is that if we are weak around our hip and our core, then we are at a greater risk of injuring ourselves when playing squash. And therefore the videos that I've already shared around lunges and floor-based gluteal exercises might be an excellent thing to link in with the exercises that I'm about to show you. So let's get started with some of those. So the first one that I'm going to show you is a lunge and a high knee drive. Now I have already actually demonstrated this exercise in the first video, but I want to repeat it because I really do value it for a number of reasons. So I'm going to ignore the towel to start off with and just show you the first variation of the exercise. So again, gently tucking in the tummy muscles, coming down into your lunge and driving the knee upwards. Just do a couple of repetitions of that so you've got an idea of what's going on. So the reason that I like this so much, number one, it works on single leg control. So from a physio point of view, we're working well for the single leg control around both the hip, knee and ankle joint. Number two, it's obviously very squash specific. We lunge and lunge and lunge when we're playing squash. So it's a really valuable exercise to train up the specific muscles that we use. And if we're going to target the patellar tendon, which I was talking about earlier, then using this towel underneath your heel can be a useful way of doing it. So bobbing your heel on top of the towel, and again performing the lunge and the high knee drive, slowly controlling downwards. It's that slow eccentric phase that can be really useful for loading up that infrapatellar tendon. As always, keep the upper body relatively relaxed as we're doing these movements. And again, repeat on both sides. Notice how I'm not letting that knee fall inwards as we perform that exercise, so as to avoid straining the MCL ligament on the inside and maintain a nice stable base of support for the internal structures of the knee. Okay, so that's your first one down. Second one I'm going to show you is a pelvic drop in standing. We need a step for this one. Again, bottom step on your staircase if you've got them. If not, you can fashion something. But essentially all we're doing with this exercise, standing on the step and keeping your hip relatively level, we're going to work on dropping one side down and lifting it back up again towards neutral. Dropping one side down, lifting to neutral. Now, recent evidence seems to suggest that this actually isolates your glute med muscle, which we discussed a couple of weeks ago, better than some of your more conventional exercises like the clamshells. And just repeat that on the opposite side so you've got the view from the opposite side. Try to keep the knee relatively still when you're doing this. It's not doing a single leg dip, which we're going to come on to in a second. The knee should remain not necessarily locked out straight, but not necessarily bending all the way down at the same time. And just for reference, this is working the glute med on the side where you're standing. So on my left side at the moment, it's working to draw that pelvis back up towards neutral. Okay. Next exercise is single leg dip, like I've just said. I'm going to use a band for it. Again, if you don't have access to a band, don't worry, it doesn't matter. You can do it without. This can be performed on a step or on flat ground. So if you have got access to a band around the knees, don't worry too much about the placement of it. Ultimately, if you've got a band, it's activating your glute muscles. It doesn't really matter whether it's below, level or above. Just do whatever's comfortable for you. And single leg dipping, you're lifting one leg up, gentle tension in the band if you've got one, so that you're switching on those glutes and coming down essentially into a squatting action. Doesn't have to be bum to floor, just go within what you can control. It's not about going all the way down if you're not able to control it there. If you're only able to control to this level or this level, just go down to that depth and don't feel like you have to go any further. I'll just show you the variation on the step if you want to do it from the step. I actually find it easier on a step just for leverage. I think a lot of that reason is actually because I'm not particularly flexible at my hips, so my opposite leg can't clear the floor that well. Okay, so next one. We're going to move on to the adductor strengthening stuff now. All of these can be used in unison really, so that's the reason I've put them all at the end of the video rather than splitting them up towards each condition. They're all useful for all of them collectively. These ones are just designed to strain the adductors a little bit more. So again, using your step if you want. Don't know how much you can see there, now we haven't got the best of space. So we're going to work on the bridging up like we did in the floor-based glutes the other week. We're doing it with heels on a step so as to strain the adductors a little bit more. And we've also got this band around the knees if you've got access to it, so that we're working glutes as well as adductors at the same time. Gently tuck in the tummy muscles, roll the pelvis backwards and lift your bottom up from the floor. Holding for a few seconds before slowly and controlled lowering that back down. And then again repeat, gently tucking in the tummy, lifting upwards. And slowly down. Just do a couple more. If you really want to challenge your leg in the single side, then performing that as a single leg bridge. So you're going to perform exactly the same action before then straightening one leg. So lifting up and then straightening one leg. Keeping a tension in that band. Even for me, this is really starting to challenge it. Slowly down and slowly down. Remember from the video the other week on the floor-based gluteal exercises, when you're lifting that pelvis up, keep the pelvis level. If you're trying to straighten a single leg as so, and your pelvis is dropping down to that side, you're probably not strong enough to control it yet, so just stick to the first variation with both legs. And just do one more each side. Okay, so moving on. Just make sure I get my order right. Right, so this one's a little bit more complex. It is actually quite difficult to do, so don't worry if you can't do it. I just quite like it. So using a chair or a high step, if you've got a high step, or maybe a second or third step on a staircase. Again, to do what's known as an adductor bridge on a single side. I think I was going to do it this way to see that. So for this as an exercise, I'm in side lying. I've only got that towel there for my elbow. You're going to rest one leg on top of the chair. Hand onto your pelvis, and you're going to lift yourself up and hold. And this is really now putting some work through those adductor muscles on the inside of the leg. Slowly lowering down and lifting back up again. Now, there are a number of different muscles as part of your adductor group, and two muscles, your adductor longus and your gracilis, have got different insertion points across your lower limb. So in order to differentiate between those two muscles and work them equally, you can do this with a straight leg and then with a bent leg afterwards. So just like to turn that around, bring it slightly in closer. And working this time with a bent knee, bridging up, slowly down, up, and slowly down. One more. Okay, obviously quite tricky, even I found that difficult at times, but worthwhile doing if you can do it and you can control it as part of your adductor training. And the final adductor exercise that I'm going to show you, which I've already got set up, is essentially pulling the leg inwards towards the body. You're concentrically contracting those adductor muscles. Just going to have to tie this band. One thing I don't like about TheraBand, they are very, very tricky to tie, especially if you've got a long piece like this. So essentially all I'm going to be doing here, standing fairly far away from there, I'm just going to work on pulling that band inwards towards my centre. Holding it for 1, 2, 3, 4, 5, slowly letting it come back out again, repeating back to the middle. I'm going to take my hand off because I'm taking off the effort from balance. Slowly letting that come back out. And again drawing inwards towards the middle. So we mentioned yesterday about balance exercises. We're going to mention tomorrow about balance exercises when we're talking about the foot and ankle as well. So although this isn't specifically designed for single leg balance, I'm actually having to work really hard on my right leg at the moment just to keep myself upright. And then obviously change onto the opposite side. All of these exercises, I know I haven't been strict in doing them, but when you are performing them, do them on the opposite side. You don't want to end up with one leg bigger than the other, one leg better prepared than the other. If anything, that is meaning that we're then at greater risk on the side that you haven't been training. Remember the piece of evidence saying that we're 80% greater risk of injuring an adductor if it is weaker compared to its opposite side. As far as repetitions go, remembering what I said yesterday, when we're treating patients, when we're guiding on number of repetitions, it is largely guided by evidence, but the important facts to consider is that it is individualised, so it is going to be dependent on the capacity of the individual that you're giving those exercises to. I would normally be performing something along the lines of 8 to 12, or with a slightly lower weight, between 12 and 15. If you can only tolerate doing 6, that's fine, doesn't particularly matter, but it depends on what you're able to do yourself. Okay, so moving on to squats. So I've left this towards the end because I've done this specifically for the patellar tendinopathy condition that we're talking about, but again, it can be linked into all the others. So again, rolling up a towel so you've got a little bit of a heel raise underneath. So we're going to stand on there. I'm going to use this band again, but as I mentioned before, you don't have to. So squatting is probably one of the number one exercises that I give out to patients, squash players included. So many reasons. We're working through the joints in the way that they're designed to be worked. It's a good way of training the knees to stay in a nice line. It's a good way of developing before we then move on to single leg control exercises. And in this case, with a towel under the knees, there is evidence to suggest that we are putting a little bit more load through these infrapatellar tendons, which is a common injury in squash. So from there, gently tucking in tummy, coming down as far as you can control, and then bring it back up. And again, I can't stress enough, as far as you can control. If you're getting down to this stage and you feel like you're not strong enough and your knees are falling in, just stick to that level. You don't have to go down bum to floor or as far down as I'm going there. Okay, so 2 more to go. This next one is an exercise for the hamstrings. Now the reason I brought hamstrings into this is that they work really closely together with your adductors, with your quads, which obviously feed into your infrapatellar tendon, and they work nicely with the whole of your posterior chain, which obviously includes your glutes. And sometimes shortening of the hamstrings can then result in those adductor strains or other problems with the hip and the knee. So, an exercise for lengthening the hamstrings out. What's going to be best for that? I'll go this side. So, exercise for lengthening the hamstrings, lying down onto your backs. Lifting these legs upwards, holding the back of one leg and keeping the knee relatively straight, so not coming down into this position. And with the opposite leg, you're just going to very slowly lower that down. And what you should feel when you're performing this exercise is it pulling like hell down this side that you're holding onto in your hamstring group. Bringing that leg back upwards, holding the opposite, and slowly lowering down. Now some of you might be wondering why I'm valuing these kind of exercises for lengthening the hamstrings over the top of, for example, stretching. Now there's a bit of a grey area and it's up for a lot of debate as far as stretching is concerned in the world of, well, physio, medicine, whatever you want to call it at the moment, as to what the value of stretching actually is. My own personal opinion is that stretching's biggest role is for desensitizing. So if you've got an achy muscle or an achy joint, then stretching can be a really useful tool to take a bit of the edge off the pain. I don't necessarily value it for lengthening tissue out. I think it does, over a very long period of time, make some sort of changes to a tissue, but it would take a number of years of really persistent stretching before any sort of significant changes are made. Whereas loading the tissue in a different way, such as this, eccentrically, or such as anything really, any sort of strengthening exercises, are generally better for a lengthening purpose. The other thing that I think I found with stretching is that, in my own personal opinion, because it desensitizes tissue, it shouldn't necessarily be used as part of a warm-up. Cool down, I don't necessarily see any risks, but if we're on the theme of reducing injury risk in squash, I wouldn't necessarily think about doing stretching as part of a warm-up, because all you're effectively doing is desensitizing the tissue that you want to be ready and prepared to perform exercise. So warm-up exercises should be lots of lunging, lots of control, lots of movement-based exercises, lots of dynamics, but certainly not, in my opinion, the static sort of stretching side of things. So final exercise I'm going to show you, what we call an RDL, Romanian deadlift. I'm going to do it on a single leg. I'm going to do it with a weight in my hand. You don't have to do it with a weight in your hand. And all we're going to practice, I'll step back a little bit, all we're going to practice standing on the single leg, and with that hand we're just going to slowly lower the weight down towards the floor, pivoting through the hip and then bringing back upwards towards neutral. You're going to have to really engage those tummy muscles if you're going to control that return to the middle. Again, don't let the knee fall inwards. It's a single leg control exercise, so don't let it fall inwards. And the benefits of this exercise, number one, again, lengthening those hamstrings out. We're trying to load it eccentrically, so we're lengthening it under load. So we're working at lengthening the hamstrings, but what we're also doing here is working on the glute muscles. And it's not necessarily something that in the past I've used as a glute exercise, but again, recent research seems to suggest that this is actually isolating your glute med muscle, on this side in my case here, better than your typical clamshell exercises. And again, very good for balance as an exercise as well. Anything working on a single leg and movement at the same time is ideal for balance. Again, perform it on both sides. I'm not going to waste video time to do that, but if you're going to do this and commit to doing it, do it on both sides. You don't want to end up with a unilateral weakness that can then place you at an actually greater risk of injury. Okay, so that's the whole of it for today's video. I'm going to be back tomorrow, which will be the final video of the little series on how to keep squash fit. And tomorrow we're going to investigate how to minimise the risk of injuries in the foot and ankles, so more distally in the lower limb. Cheers.